Hello, everyone, and welcome. Thank you for joining us for today's webinar on mental health and the high cost of living. My name is Ed Mantler. I'm the Senior Vice President and Chief Program Officer with the Mental Health Commission of Canada. It's my great privilege to be your moderator and timekeeper for the day. Before we get started, I want to acknowledge that the Mental Health Commission of Canada operates primarily on the unceded, unsurrendered territory of the Algonquin Anishinaabe Nation, whose presence here reaches back to time immemorial. The Algonquin people have lived on this land as keepers and defenders of the Ottawa River watershed and its tributaries, and we're privileged to benefit from their long history of welcoming many nations to this beautiful territory. We're here today to talk about the high cost of living and the impact that it's having on us as prices for groceries, rent, and housing continue to rise. That puts pressure on our financial security and impacts mental health and well-being. Mental Health Research Canada, through a national survey conducted in September, found that more than 1 in 3 respondents are struggling to adequately feed themselves or their families and feel financial pressures are affecting their mental health. The pressure is also magnifying existing inequities for diverse communities and impacting access to mental health care. These issues and many more will be explored by our fantastic group of panelists today, which includes Asifa Sarang, the Executive Director of Across Boundaries, M. Alexander, Co-Chair of the Youth Council at the Mental Health Commission of Canada, Catherine Scott, Senior Researcher at the Canadian Centre for Policy Alternatives, and Mark Murray, who's the Branch Co-Manager and Building Bridges Manager with the Canadian Mental Health Association in Halifax, Dartmouth. Before we get started, just some quick housekeeping notes. Simultaneous translation is being provided throughout the webinar today. To listen to today's event in your language of choice, select interpretation at the bottom of your screen and click on language. We'll be discussing some potentially troubling topics today, so if you feel that wellness support is necessary during the webinar, you'll see that we're providing the links to several helplines in the chat. And as well, our colleague Sandra Gosling is here to provide support as a mental health first aid responder. If you'd like to reach Sandra during the webinar or following the webinar for a debrief, she can be reached by email at sgosling@mentalhealthcommission.ca. And that address, again, will be placed in the chat for a quick reference for you. At the end of the panel, we'll have time for some interactive questions and answers from you, our audience members, and we're hoping to hear from you. So please submit any questions that you might have into the Q&A box at any time throughout the webinar. Before getting into the panel discussion, I'd like to introduce Katerina Kalantra, I can't say her name, I'm sorry, Katerina, Senior Policy Analyst with the Mental Health Commission of Canada. Katerina is going to be presenting some of the findings from a soon-to-be-released policy brief from the Mental Health Commission that explores the impact of the high cost of living on the mental health of Canadians across several key domains. Over to you, Katerina.
Thanks, Ed. Yeah, it's a tough Greek last name, so I
struggle every time. I'm sorry.
It's Kalantarides, not Katerina Kalantarides. And it's nice to see other people are introducing themselves in the chat too. Thank you so much for being here and taking the time out of your day to listen into this important webinar. I'm going to share my slides now. So over the past year, high inflation across Canada has had a significant impact on people's lives. This includes increased gas prices, like I'd mentioned, utility costs, rent, mortgage rates, and the price of food. The financial pressures are a constant topic across our news cycle, as the slide shows, but they also hold important policy considerations for which the impacts of the high cost of living on mental health are extremely relevant. Over the next 10 minutes, I will be providing a quick overview of the emerging issues, policy considerations, and recommendations. These highlights come from a full policy brief that will be released on Monday, November 20th, on the policy and research section of the MHCC's website. So if they haven't already, a member of my team will link to that section of the website in the chat where all of our policy briefs are available. And you can go in on Monday and find the policy brief there. So the COVID-19 pandemic created precarious economic conditions and exposed gaps and systemic weaknesses across the social security system in Canada. It disrupted the capacity of health, mental health, and social services, as we've all seen, and various sources of stress have led to disproportionate negative impacts on mental health across the population. The critical issue is that since the end of the emergency phase of the pandemic, polling from Mental Health Research Canada shows that mental health symptoms across Canada continue to remain elevated, higher than pre-pandemic levels. At the same time, high inflation has led to increased financial insecurity, and policy reforms are being scaled back by all levels of government in favor of a more fiscally restrained and targeted approach. So we have known for a very long time about the link between income inequality, the social determinants of health, and overall well-being. We know that having a low income and living in poverty not only affects people's everyday living and working conditions, but it also significantly impacts mental health, social connections, self-determination, and quality of life. High inflation over the past year has had a significant impact on financial security for many, and food affordability has become a nationwide problem. Last year, Statistics Canada surveyed Canadians, and 35% said it was difficult for their household to meet its financial needs that year, while 1 in 4 people said they'd be unable to cover an unexpected expense of $500. The increase in inflation has also contributed to a major gap between the living wage and the minimum wage. In Ontario, the minimum wage for adults is $15.50, while the living wage is $23 this year in 2023. In BC, it's $16.75 for the minimum wage, while the living wage is $26, and in Nova Scotia, it's $14.50 for the minimum wage, while the living wage is $23.50. At the same time, food bank usage has reached historic levels and increased to nearly 1.5 million visits this past year, and 5.8 million Canadians, including 1.4 million children across the 10 provinces, were living in food insecure households in 2021. Just this morning, I went past my local food bank on a morning walk and saw a huge line. So research from both the United States and Canada demonstrates that food insecurity specifically increases the risk of depression and anxiety symptoms, mood disorders, eating disorders, and suicidal thoughts. It also shows that when higher minimum wages are instituted or financial security increases, there's more job stability, a pathway out of poverty, and less mental distress. And we know that a range of income and benefit supports are needed to substantially address income inequality and the associated effects of mental well-being. This could include reevaluating income supports to bring them up to date with inflation, increasing the minimum wage, and exploring universal basic income and portable benefits. Increased housing unaffordability and the related housing shortages are also impacting the mental health of many communities across Canada. Core housing need continues to grow past 10%. More than 200,000 households are waiting for social or affordable housing nationwide this past year, with most waiting at least 2 years, and chronic homelessness has increased by 79% from 2020 to 2023, as researchers found at the Canadian Alliance to End Homelessness across a sample of 14 communities. That's an increase that outpaces current shelter capacity. And unstable living conditions and homelessness are at a minimum distressing, proven so by Calgary's Distress Center, which reported receiving 2,500 calls from people last year needing shelter or housing. And of those calls, 65% involved a mental health or suicide-related concern. Across primary and emergency healthcare, mental health, and social services, there is a lack of coordination and limited resources to meet the complex needs of people who experience mental health challenges and precarious housing or homelessness. This doesn't need to be the case, though, given the existence of effective evidence-based solutions like Housing First, a model of supportive housing with built-in mental health and substance use services. Although governments invest in increasing the availability of affordable housing, there are limited investment opportunities for supportive housing programs for people living with mental health concerns. One important consideration is that for some, serious mental illness can have a more severe impact on daily living for a longer period and can be an impairing and disabling experience. According to Statistics Canada, Canada's most recent survey from 2020, about 20% of the population reported one or more co-occurring disability, and mental health related disabilities were the fourth most prevalent type. People living with mental health related disabilities have a harder time finding and maintaining employment, face greater financial challenges, are more likely to be reliant on caregivers, government benefits, and community supports. With the rising cost of living, needs among people with mental health related disabilities have grown. And at the same time, most provinces have a large gap between social assistance rates and the poverty line. It can be as much as $15,000 a year. While barriers to accessing social assistance and other services and supports remain high. Excitingly, in June 2023, the government passed Bill C-22 to create and establish the legal framework for the new Canada Disability Benefit, which has the potential to address income disparities faced by people living with mental health related disabilities. However, the government has yet to provide details on eligibility criteria, the amount of the benefit, or how it will fit with other government benefits. On top of this, we are also concerned about the impact of the high cost of living on access to mental health services. Mental health services are effective and backed by a wealth of research showing that investments in this area bring benefits for well-being and economic outcomes. Financial barriers to mental health services hinder people who are most in need from accessing them. People with low incomes are among those least likely to report having a regular primary care provider, and unless accessed with employment benefits, most private mental health services have a high cost. While free virtual services and publicly funded community-based services are affordable, they are stretched, have longer wait times, and allow limited visits without long-term support. So addressing financial barriers to mental health services are critical and require a whole system approach. This includes taking into consideration the unique mental health impacts on diverse communities, as when combined, long-standing inequities and financial insecurity magnify mental health concerns and hold significant barriers to accessing services and supports. Such inequities are experienced differently across various diverse communities, including First Nations, Inuit and Métis, rural and remote communities, newcomer and racialized communities, to LGBTQ+ communities, children, youth, and older adults. The policy recommendations that I have reflect that a wide range of policy measures are needed to address the mental health impacts of the high cost of living. They include meaningful engagement with people with lived and living experience, consideration for the unique needs of diverse communities, and an obligation for greater data collection, evidence-based decision-making, and accountability measures across all levels of government. So that's it for me. That's my 10 minutes. I also wanted to highlight that we have an amazing new resource out today, a tip sheet on navigating public and private mental health services in Canada that will also be linked in the chat. If you have any questions, feel free to put them in the chat or in the Q&A box. We're collecting them, and at the end of the panel, I'll be around to answer any questions you may have. Thank you.
Thank you so much, Katerina, for sharing a lot of information, a great overview of the policy brief, including the policy recommendations that will be publicly released early next week. So I encourage you to go to the MHCC website and see when that is published next week. So stay tuned there. You know, we're hearing a lot about how the cost of living is impacting our mental health as individuals and as communities here in Canada. We know that it's contributing to increased financial insecurity, to greater pressure on food and housing, affordability and income inequality, all of which significantly impact mental health and well-being. We've also heard about the ways that the high cost of living is magnifying existing inequities for people's mental health, for individuals in diverse communities, and making it harder for people to access services and support. So I'm very interested to hear some opinions on this from our esteemed panel. They'll be delving into these issues throughout the webinar, but I'd like to start off by asking each of our panel members to weigh in on what you're observing yourself. How are you seeing the high cost of living impacting mental health? You know, across your communities, your services, your supports, and the policies that you see in place. Would you like to start us off, Em?
Yeah, absolutely. Thank you. So there's so many different ways that the high cost of living is negatively impacting people's mental health across the country. I think some of those are rather obvious and others are maybe more indirect. For example, an increased cost of living, you know, without having the increased income to compensate means that people have less money to spend on mental health care. It's a very direct, clear consequence. This is the case for many people already, and that's already a privileged group because so many people in Canada don't actually have access to affordable, quality mental health care and likely don't feel like that's necessarily even an option anymore. So there's an ongoing housing crisis in many areas of the country. Newfoundland is definitely no exception to that. And the cost of living has really forced people out of their homes, made them unable to pay rent. It's incredibly challenging to take care of your mental health when you're living without having that stability, not knowing where you're going to live. And a big one here is not knowing where you're going to get food or how you're going to take care of your kids. And so that increased cost of living is putting people in the situation where they're having to make decisions about, you know, where they're spending their money. And when that happens, there's big sacrifices that have real consequences. I previously worked in frontline food security provision in Newfoundland, which has one of the highest rates of food insecurity in the country. About 14.7% of households struggle to put food on the table. And I would hear from clients daily who were genuinely just having to choose between rent, food, heat, medication, and a shocking number of people were choosing to either decrease their medication so they could eat, or eat, but, you know, skip out on their own meals so that their kids would be able to eat. And that was really hard to hear about, you know, parents going without food so their kids could eat, and even situations where parents actually had to send their kids to live with another family member because they couldn't afford those basic necessities. So, you know, imagine how devastating that is to someone's mental health, their sense of worth, their dignity, and the hopelessness of not knowing when and if things are going to get better. So from a logistics perspective, even people are having to work longer hours to keep up for those who are able to do that, who are those in those situations. And many people have had to pick up a second, third job to make ends meet, which makes people have less time to spend on things that would actually bolster their mental health, physical exercise, spending time with family and friends, you know, actually attending those mental health care appointments if they're available, recreational things like artistic expression, things that would improve or at least support people's mental health as a part of that process. So not only are people not affording mental health care, they're also spending more time towards earning money. And with the rise in the cost of living, it's really a vicious cycle that's pushing people farther into debt, into poverty, and ultimately into poor mental health.
Thank you so much, Em. And Asifa, I see you nodding. What are you seeing in terms of the impact on mental health of the cost of living?
Thank you, Ed. And yes, I was nodding because Em was saying everything that is just so relevant. So just for context, I'd like to say that my organization across boundaries works exclusively with racialized and Black communities. We have been for 28 years, and this is our mandate. So our board and our staff are also exclusively from racialized communities, and therefore my comments today will be based on this very unique setup that we have. If we look at who we serve, beyond the fact that all of our service users are racialized, of the approximate 900 service users we have, the majority have education levels ranging from secondary to university, which is great because they should have jobs, careers, etc. Correct? Well, majority of our service users' primary source of income is ODSP followed by social assistance. And this is not a new phenomenon for us. This is something we've seen over and over in our work, whether it's due to systemic racism, anti-Black racism, or other forms of marginalizations. So our service users have always battled poverty, living on fixed income that keeps them fixed below the poverty line. What we are seeing now is that the gap from what they had in the past to what they can afford now is much wider. The dollar doesn't go far enough. They can't make ends meet, causing anxiety, stress, isolation, depression, now even more than before. At the end of last fiscal year, in the beginning of this year, we had service users who were clamoring to get back to meeting in person. They were tired of Zoom meetings and virtual supports, and we were happily, planning to get into the full on-site programming mode. But then as time went on, I noticed that things were not moving forward the way they should have. Our service users were not only not wanting to come out, but also not wanting to have visits at their home or meet in the community. This seemed to have been a 180-degree turnaround. So what we're finding is that our service users, and to be frank, our staff as well, like Em said, and staff who not only have had to move further and further away from the city to find more affordability, possibly, or take on second jobs, salaries have been moved up in years and turnover is high, that to our service users and our staff, mental well-being is now secondary to the urgent primary needs of food and shelter. And while the impacts on our mental health and physical health is huge, taking care of ourselves right now becomes a luxury which we're unable to afford, leading to a downward spiral. So these are the direct impacts, but then there's also an indirect impact in this climate. With all the stories of increasing food prices, rent, fuel that we hear, we're also living in a state of anxiety, almost waiting for that other shoe to fall. So some of us may be just one paycheck away from losing our home or getting deeper into debt and unable to come out of it. And when we have that little free time in our lives, we take up maybe unhealthy habits, potentially substance use, or in order to shut out the fears and the uncertainties. And even if we're not in crisis, we kind of begin to live in a perpetual silent crisis mode. We came out of a health pandemic to land into a financial pandemic, which is now going to take us back into a health and mental health pandemic. This is unfortunately just how it feels. Thanks, Ed.
Great. Thank you, Asifa, for your observations. Catherine, what are you seeing?
Thanks very much, Ed, and this fantastic panel. I'm really happy to be participating today, and I'm just taken. Katerina delivered a terrific overview of where we're at right now and the fundamental connection between mental health and our financial security, and both Em and Asifa really laid out what's happening on the ground. One of the things, what am I seeing today? Well, I saw yesterday, for instance, that the Daily Food Bank in Toronto announced that 1 in 10 households in Toronto were accessing services that had experienced a 51% increase over last year in the number of people in households. A huge portion of those, 40%, are kids. And many of those folks, of course, are on fixed incomes such as social assistance or ODSP, the Ontario Disability Public Work. But that plays out obviously across the country, that people are up against the wall. The cost of living crisis has magnified. It shows no signs of abating anytime soon. I think certainly the core of that are the challenges in the housing and shelter. Like, we know for a fact that obviously affordability is off the dial, and then it trickles down wherever you are in the income ladder, how those challenges are being magnified, particularly for renters who are looking at exponential increases in the costs. And of course, most low-income folks are renting their accommodation. We have, for instance, over 800,000 households in Canada today are spending more than 50% of their income on housing. So, in that context, of course, people make those sorts of decisions. They go to the food bank, They don't pay for needed medications or supports. They don't access other services. They don't see family and friends. Creates that kind of spiral that Asifa was, really powerfully talking about. I see as well, the place that we're in, we've come through this terrible pandemic, mental health, which, on all sorts of fronts really challenged us financially, challenged our health, our security and well-being, saw high levels of violence that have continued to increase. We really have not really recovered. People keep on talking about how the pandemic's behind us, and in many ways it's so profoundly is not. So I think it's really important context and scrambling to get ahead of it. I think, we really have a moment where we need to pull together and look at the options and to zero in on communities such as folks with mental health challenges, who navigate that and, all of the complexity that's involved in that hugely, diverse community, but zeroing in on the folks that need the most assistance, that's really important to the whole policy conversation going forward.
Great, thank you, Catherine. Marg, would you like to add to the conversation?
Yes, and thanks for inviting me here today, and really pleased to see, looking forward to everyone being able to read this new policy brief from the Mental Health Commission of Canada about the high cost of living and mental health. And it's really important information. But being from Halifax, I certainly, most people know that we've had unprecedented numbers of people in our community who are experiencing homelessness and not having their basic needs met. And there are more and more people I hear from, not only through our programs, but from the community, who are living in fear that they might be next, that, worried that a fixed term lease or someone getting around the rent cap or rent evictions will, just leave a person with no choice. And I think so many great things have already been said by the other panel members. And I think Am had mentioned about hopelessness, and that certainly has a major impact on mental health, hopelessness and anxiety. And when people start expressing hopelessness, that, and not thinking, even though we're here today talking about policy change, sometimes people have lost that hope that there will be change. And that's going to, it just has a terrible impact. And I see housing organizations in our community, they're exhausting themselves to keep more people from falling through the cracks. But we know the lists of people, they just keep growing and growing. And the housing subsidies, which has been a good thing that our provincial government has offered, rent and housing subsidies, they take longer to come through. And now the average housing cost, I think, for just a basic apartment in many areas in our city are between $1,800 to $2,100 a month. And people just can't meet these rising rental costs. And I know that in the report that's being released on Monday, it does say for Halifax $23 an hour, which was true when that report was written. But within less than a year, the living wage has gone in the Halifax region from $23.05 an hour to $26 during the past year, and minimum wage is $15 an hour. And certainly most of the individuals who are accessing our social support programs were already living well below the poverty line. And during the pandemic, people, there were, as it's been alluded to already, there were some programs that really helped and showed that we could do things a little differently. But many of those, that's helped even organizations like ours offer more help for food and other essentials. But many of these grants have ended, or they'll be ending in early 2024. So we know efforts are being undertaken by many levels of government, all levels of government, community partners to address homelessness, poverty, housing, food insecurity. But we need major changes to find solutions for poverty and address the social determinants of health. Here in Nova Scotia, we have received very low scores for addressing poverty. And I think as a society, we do want most vulnerable people living with illness or disabilities to have quality of life. We all deserve to have quality of life. And with our income support program so low below the poverty line, they're very punitive. And that's not any one government. I mean, we've had 30 years of neglect from not investing in social housing. And we also have not invested in mental health and substance use care as we should have, because many people are always surprised to hear like it ranges in various provinces from 5 to 7% of the healthcare budget when the recommendation is 12%. So all of these conditions certainly make it harder to deal with the high cost of living. And as has already been said, the pandemic was stressful. I mean, and now it's compounded by another crisis. And the last thing I wanted to say is that I saw a post by ADSM for Women and Children the other day, and they were commenting that there was the expression of the need to provide shelters when it's too cold to live in tents. But I thought that was a very good comment, because they said, are we normalizing this now? Like, is it okay for our neighbors to live in tents from March to November with no access to electricity or running water? And I'm old enough to remember, I think it was that they had said back in the 90s that they'd end our reliance on food banks by 1996. Well, we know that was like 27 years ago. We know food bank use is skyrocketing. So we have to be careful not to normalize these food insecurity and homelessness. And I'm so thankful that we have many programs like the food banks, but they also advocate for to address food insecurity and poverty. And I think that the impact on mental health, as has already been said, I mean, there's feelings of stigma, shame, anxiety, hopelessness. And that's just terrible for people to be experiencing. And
Thanks for sharing your observations, Marg, and thanks for the panel as a whole. We know, though, that the impact of the cost of living on our mental health is experienced in different ways. And Katerina shared some evidence that the cost of living is actually magnifying existing inequities for mental health for diverse communities and making it hard to access services. Asifa, you mentioned that you're working primarily with racialized communities. What are from your point of view, what are some of the intersectional considerations that you're seeing in your communities?
I'd say, Ed, that obviously the standard intersectional considerations, as you just mentioned, food insecurity, precarious employment, transportation, daycare, etc., are there. But then you add to that race, ethnicity, to LGBTQ plus identities. You take in, different generations, youth, newcomers, older adults. And within these communities, the propensity towards maybe higher chronic health issues. And then with each identity or descriptor added to us, the negative impacts on our health and mental health increases exponentially. I also think intersectionality is very nuanced, right? You combine this with limited resources, overextended supports in the city, inappropriate or culturally inappropriate services, lack of access to those services. And then for the communities that we work with, misdiagnoses or overdiagnosis, and the list goes on. So really, there are no supports or safety nets, no affordable options. And this is why the communities that we work with and interact with are so complex. The needs are so deep and the responses are so limited, or in some instances, incomplete. Another aspect is that our communities are very intertwined. We're all about family and community, and therefore very interdependent. So if one person is experiencing a crisis, it does affect and impact everyone else. Many of us are connected to back home, and back home can be any part of the world. We're also oftentimes a source of financial support for many back home. So then we add guilt to already stretched and fragile emotions, the guilt of being unable to support your loved ones, the guilt of having that little bit more than they have. And then furthermore, what is happening around the world impacts us as well. So from situations of war, Russia, Ukraine, Palestine, earthquakes, floods, all of these things have impacts not only on the supply and production of goods, but also on the mental well-being of people who are from these parts of the globe. Canada is not an insular society, and our lives are intrinsically connected with families and communities. So the day-to-day impacts on our mental health is severe. For example, I'm from India, I'm a Muslim, I'm a female. I'm impacted at so many levels from so many things that it brings a heaviness to my days. And this is without me struggling with a mental health issue or substance use or being on medications with various side effects. So I think that none of us are immune from our hearts and minds feeling heavy, but the impact on our service users is higher. The last part I think I'll add is, I am touched upon it, is that, we can't afford to, because of the priorities that are in our lives, we can't really afford to focus on rest, relaxations, vacation, entertainment, the ability to go out for a movie, hang out with friends in a restaurant, have cable or Netflix or internet and YouTube, the really small things that act as a buffer to the daily grind, which many of us can take for granted, are actually protective factors that are no longer available because of the high cost of living. So again, this goes back into the same spiral, right? You get isolated, you get depressed, you get further isolated, and then it just gets harder and harder to get better. I think I'll stop there. So actually one quote I wanted to share from this article I read about from Economics Observatory, an author, he put it like this. He said, "We run the risk of entering an indefinite phase of eugenics by negligence by allowing the continued rise of poverty and health inequalities." For me, that was a really chilling statement and something that we really need to be conscious about and be aware of. Thanks.
Wow, that's a really powerful quote. Thanks for all those comments, Asifa. Em, would you like to build on that?
Yeah, that is a big quote to follow up. Thank you, Asifa. So for me, a bit of a different lens. So I identify as a queer Indigenous mother with European ancestry. And I want to recognize that I hold a tremendous amount of privilege despite, my own intersectionalities or my own intersectional identities. Sorry, I do have white passing, cis passing, straight passing privilege. And I think it's just really critical to be mindful of the fact that there's so many groups who are disproportionately affected by the increased cost of living. We know, for example, and I'll speak to those that affect me because I don't have any right to speak to what others are experiencing. But we know that people in the 2S LGBTQIA+ community are already at more than twice the likelihood of experiencing a mental health disorder within their lifetime compared to their cisgender hetero counterparts. And the queer community is also, 2.5 times more likely to experience anxiety or depression, and also faces significant challenges in finding safe and inclusive housing, which I think we've clearly linked to folks' mental health as well. As a young person, I'm told I'm still a young person. It is very daunting for the up and coming generation to think about buying a home, and for many people, owning a home is genuinely not in their realm of possibility anymore. It's not what they aspire to do because they don't feel like it's possible. And I think that makes a huge difference in people's mental health because we're talking about long-term stability. And always kind of wondering where's next, what are we going to do? And when we look at the cost of living and home ownership, maybe a few generations ago, compared to income levels, we're starting out with a huge disadvantage compared to many of our grandparents or even our parents. I consider myself extremely fortunate to have recently purchased a home, and I know that's only possible because I moved back to Newfoundland and out of Ontario. If I had been in Ontario still, there is no chance that we would have a house downtown Toronto, and nor would we in probably 10 or 20 years. And yeah, so that's where I'm seeing the impact of the high cost of living is hitting hardest for people's mental health, at least in my community. It's a lot of young people, people of color, queer people, those who have, chronic physical health conditions. And it's like the system in a lot of ways can be set up to support folks who maybe have one or two different intersectional identities. But then when you get into, oh, well, I identify as this, and I'm a part of these different groups, and those things add up, it's like it almost breaks the system. And the disproportional impact, it just keeps compounding. And I think in a lot of ways, that's actually a real testament to the resilience of these people that are still able to get by with all of those barriers that they face. And I just want to commend people that are doing that, and they shouldn't have to. Approximately 30% of all unhoused people currently living in Canada right now are Indigenous. And I mean, let's be real, there's a serious issue of systemic racism, sexism, discrimination in health and other social service systems. And that's a big part of why we do see these disproportionate rates of mental health concern in some marginalized groups. So I think we really need to pay attention to that. And what do we know about people in marginalized groups who seek mental health care? They certainly are not always met with timely, culturally appropriate and affordable care. And that's something that we're working on. It's something I think we need to keep working on and investing in as a society.
Great, thanks, Em. Marg, I wonder if we can turn things to you. Em had alluded to some of the barriers or challenges that people face when accessing services, and you had alluded to these as well in your earlier comment.
Yes.
Your thoughts on how those challenges or barriers to accessing mental health services are actually being magnified by the cost of living, what we can do to address that.
Yes, well, that's certainly there are many basic things that sometimes interfere for people accessing today, like transportation, lack of digital access. Many appointments have gone online, and also finally perhaps getting access to care in the public system, but then finding that it's so short term that it doesn't resolve anything. And it's almost like managed care, and that's very disheartening for people who have been coping not only with the high cost of living and maybe facing poverty, but are also living with mental illness or mental health concerns or substance use issues. And something that we're seeing, although there's been new efforts made to provide more access through like central intake and 211 and other areas, there's the area of mental health literacy, it's not always widely understood, and quite often in a system and step care and those sorts of things, we talk of mild, moderate, and severe. And sometimes people do not get access to the care they need because they're not considered severe enough, but sometimes then they go for other types of even virtual support and they're told that they're not mild enough. So that may be something no one else has encountered, but it's a problem for many of the people we serve. And it's just also the demand. I mean, if we think about the high cost of living, the impact it's having on mental health, and undoubtedly the increase in people seeking mental health care, be it from the private system or the public system, just think if we could address the social determinants of health and health inequities, and then people, could get the help they need at the right time. So I think we just need to tear down the silos between health, community services, and justice. Some people are receiving excellent care for the mental health system and living in supportive housing, but others are just so falling through the cracks because more people who are living with serious mental illness or mental health concerns, they don't have access to maybe a family doctor or a provider. They've just fallen through the cracks. So we need to revamp many of our systems. And I think that if we could only address the issues, not of the social determinants of health, I think it would be so hopeful that people would have better access. And it's just my personal opinion, but something that's really worrying me right now is MAID coming into effect solely for mental illness at the end of March. And although the requests might be denied, I'm really worried that people will consider this due to the living in poverty and lack of access to care, which would be heartbreaking. And I know the disability community has already been talking about this a great deal. And when that type of thing, when we talk about that, we just can't let that happen. And I do want to share just a couple of things from Canadian Mental Health Association. The economic cost of mental illness to healthcare and social support systems, like in 2021 was projected at close to $80 billion. And Canadians spend an estimated $950 million a year on psychologists in private practice. And about 30% of this is paid for out of pocket. And we have many people who come through our doors or call us who, they look longingly that it's a two-tier mental health system. And to increase access for people living in poverty or don't have access to this care, I mean, we really do need universal mental health care.
Thank you, Marg. Em, what are your thoughts on how the high cost of living may magnify barriers to accessing mental health services?
Yeah, so for me, I think this is so challenging because we're finally talking about what we can do. I think we all know that figuring out the solutions and actually implementing them is almost always much more difficult than identifying the problem. That doesn't mean that it's necessarily a futile effort. And I think it's still, this conversation is still very important for us to be having and to continue to have. So I think specific to those who are on low income, and actually for me, one of the first things that comes to mind is older adults. That was kind of the focus of my graduate research. I've worked, have a strong interest in geriatric mental health and well-being. And so when I think of those who are on fixed incomes, I also think of those who don't have the capacity to increase their income, regardless of what their circumstances are. Like, they're not able to go back to work. And I think that with, the increased cost of living in general, I think that's being seen. Newfoundland and Labrador has one of the fastest aging populations in the country, with a great need for more supports for physical and mental health care. It's being seen in rates of depression. It's being seen in food bank use, which now, by the way, the middle class accesses on a regular basis. It's being seen in situations where older adults are having to move in with their children because they can't afford to get by because their income doesn't go up. And I think some of the potential solutions to that really are retention of healthcare workers. We do need long-term care reform. And I think for a lot of these things, we will need political buy-in. And I think that means continuing to having those conversations and making them relatable. And in addition to that, so we're seeing people who are already struggling to access and afford mental health services be in a place where they have to make such big sacrifices. That's not to say the cost of living isn't impacting people as a whole, but maybe some of you, you've changed brands of some things you've bought at the grocery store, but you're still sort of able to make, I'm talking about like Heinz ketchup or whatever, but like you're still able to make some things work. And people who are on low income or facing poverty right now, they're facing these pressures just to survive. And that's what they're in. They're in survival mode. And I have a background in trauma, and I'm like very well informed, like they're in survival mode and they're not able to address their mental health because they're working on just getting through that day. And I think what we really need is policy change to get people out of that crisis mode so that they're able to make ends meet, so that they're going to thrive. If we could get these people out of crisis mode, get them out of survival mode, and invest in that up front, it's gonna save a lot of money in the long term. And I think that's where we need to go. And I know it's a long road ahead, but I look forward to having more conversations about it.
Great, thanks, Em. You mentioned policy change, which I want to loop back to in just a moment. But first, Asifa, would you like to weigh in on the issue of access barriers?
Yeah, access barriers and what can we do to potentially address them? So the barriers for us, outside of all the systemic challenges that we face as a society or communities, tend to be generally predominantly around stigma first and foremost, accepting that there is a mental health issue that needs support. But once we get over that hurdle, then it is finding an agency that can actually understand our lived experiences, providing culturally relevant services. And then we need to be able to access those services. We've heard already we're encountering long wait times, lack of access to more in-depth counseling, talk therapies, which many organizations don't offer, and understanding that protective factors for those in our communities tend to be quite varied. There are, of course, other options in the community, but then again, they may not be readily available or with additional extra costs, which is not possible for everyone. So in terms of addressing this, I think as an organization, we ended up having to look at like the immediate response. So when the pandemic hit, the first thing we had to look at was food supports, right? Within a few days, we had hired a cook and we started a food program because our service users, as I already mentioned, were already very much below the poverty line. And this food that they used to access at our agency was their lifeline. So, last year, for example, alone, we provided over 11,000 plus hot meals and grocery hampers. And for many of our service users, that was the only source of food for them. We also found out through the pandemic that almost 1/3 of our service users did not have a phone. And, while a lot of organizations we were working with were kind of saying, oh, great, virtual supports, we were able to really swivel to that, I was totally taken aback. In fact, I was blindsided by the fact that 1/3 of our service users didn't have a phone, a data plan. And so how were we going to support them? So we spent a lot of time, advocating and purchasing phones with data plan. We thought that once the pandemic was over, these things could be taken back or reduced or modified. And unfortunately, what we're finding is that in a number of instances, we're having to increase those supports. We also need to look at some longer term solutions, which I guess would require more time, more investments, and more will. For example, I mean, we Across Boundaries was a part of the Housing First program through the Mental Health Commission of Canada when it did the 5-city across Canada research program back in 2013. So from our personal experience, it was very successful. We were able to house about 100 service users from racialized communities, wrap them around with supports and services. And then, what we noticed was that there was a high rate of success in this. After 2 to 4 years period, there was a stability in the individuals' lives. They were still housed. 80% of folks were still housed. They had connections to the community. They were achieving their goals. You're reunifying with their families. So if we can expand such programs, if we can find the funds to provide this, it would go a long way to addressing a basic need without which the mental health issues would be exacerbated. We recently had about 13 people visit us from New Zealand who were coming to Toronto around the Housing First program. So they'd actually instituted that in New Zealand, and they were trying to kind of check in with us and the other organizations that were part of this program just to see from our learnings. But one thing I found it was interesting for me was to learn that Finland apparently has had a full-on political will to implement this strategy. And I've read that they are looking at eradicating homelessness. And I was actually surprised by the word eradicating homelessness by 2027. So, mind you, this was an article written in 2020. And so the target date may have shifted, but it is in their lexicon, it is in their politics. And I think that's what matters, right? To be able to have that. Just one final piece I'll add is that when it comes to debt, a lot of our service users experience debt, are struggling with debt. And it's really important to make that conversation a normal conversation. Oftentimes, I think people will say, well, I'm not a finance advisor, I'm a social worker, but we don't have to be that. We just need to incorporate those discussions like we would any therapeutic interventions. I found something online that, there is actually a tool that is produced, a guide that is called Final Demand, which was produced with people who have direct experience of mental health problems. And it's based on research. And what it does is it hopes to make sure people can access free debt advice before they reach a crisis point. So I thought having those sort of tools, having those sort of resources would make it much more easier for us to engage in those conversations where we can start addressing the high cost of living and those low points in our lives. So I'll be happy to share that resource because I think having access to those sort of guidelines and supports can help us go a long way in addressing some of these pieces.
That's great. Thank you, Asifa, and thanks for sharing that resource. I do want to change direction and talk a bit about public policy. But before I do, just a reminder that we will very shortly move to a more open question and answer period. So if you've got questions, please just pop them into the Q&A feature, which is down at the bottom of your screen, embedded within the 3 dots at the bottom right. And we'll have the opportunity to direct questions to individual panel members or to the panel as a whole. But public policy. So, during the pandemic, we really saw unprecedented policy measures taken to help mitigate the impact of the pandemic on public health, but also on the financial health of Canadians and other social determinants. I'm wondering, Catherine, what kind of policy opportunities do you see existing currently to address the mental health impacts of the cost of living?
Yeah, no, the pandemic was that moment when communities mobilized and the government very quickly, federal governments and provincial governments, struck a deal when it was clear the EI system was certainly not up to the task, to the massive rise in unemployment that occurred in March 2020, where programs were, breaking under the weight. There was no way that our creaky social safety net was going to be able to support Canadians and all sorts of folks in Canada in their time of need. And we, rolled out CERB within a 6-week period, which would normally have taken years. I mean, it was really an exercise. And in fact, the research we've seen since then was that there would have been a precipitous rise in poverty, but what in fact happened was that poverty rates halved in the country. And so hugely impactful. to deliver that financial support. And of course, in 2021, we started to see it tracking predictably. It's tracking up again as those pandemic supports were wound down. This conversation has been so interesting, right? Because, we've got this, and it is the key question, what to do. And I'm really always struck about the challenge around what we need to do to strengthen the foundations of our social safety nets. So like income security programs, a stock of supported and public housing in Canada, which of course is, woefully inadequate and just minuscule proportion of the housing stock as compared to other European countries, for instance, or what we're doing around, our healthcare system, which is so strained and under crisis right now. The pandemic has not, in our healthcare system, of course, has not gone away, whether it's the backlog procedures or the mass exodus of care workers because from just the just grievously low wages and the disrespect that was occasioned through there. We're things. So this idea we need to strengthen the foundations of our social safety net, at the same time spending a lot of time focusing on what are the specific needs of particular communities, because that's what's going to that's what's really necessary to address need because of the unique experience people have. So, there are a couple of things in the window right now. We're talking about these, and I'm conscious of the time. We've got income security program reforms that are underway. We talked about the Canada Disability Benefit, and that is under negotiation right now. And that does have the potential to be a game changer for folks with disabilities, and including, of course, folks who are facing mental health concerns. I would say in that, and it's being engaged, and I'm not sure whether folks, I'm not in this community, but it's a very siloed conversation. And I was struck that there were actually no mental health orgs at the House of Commons hearings on this. It really is a group that needs to get mobilized and engaged to make sure that the definition of disability that is actually adopted for this new benefit may well include folks with disability, long-term mental health disabilities, because as the pandemic support that went to folks with disabilities actually only targeted those who qualified for the disability tax credit and or veterans or CCPD. So it was a very narrow definition. So lots of folks got left out. So that's really important around things that can make a difference, like the definition of disability, making sure that it's an inclusive one. I think we need to be looking at like the reform of EI. We haven't gotten on with that either, for the next time. What was amazing about the CERB and the way it was structured were so many people who would never have qualified for EI got swept up in that and experienced, that peace and that came with financial security over those months. And that was a real lesson that I hope we can learn. I'll mention two other things. Really important, our national housing strategy is really failed communities and acute needs, such as those with mental health concerns, in terms of its lack of focus and attention on public and supported housing. And we've made really effectively, since 2017, almost no progress on that. Although the Rapid Housing Initiative, hugely important, that was brought in through the pandemic. But again, we're talking hundreds of units, not the thousands that are needed. And of course, we've got the promised National Pharmacare Plan. We've talked about how important that is in terms of accessing mental health supports and the like. Canada's the only country that does not have pharmacare included, and it's universal. And we're really concerned about the model and whether it will really ensure that folks have access to those critical supports, such as medications, and that's a big issue, and it's a big cost of living issue too. So those are some of key areas that I think are part of the global solution, along with the targeted community service response.
Thank you very much, Catherine. And Marg, would you like to weigh in on this issue as well?
Yes, I'll try to be brief because I know we're losing time here. Catherine, I appreciate what you were saying, particularly about the disability benefit. And you're right, the mental health community certainly has to get more involved in that area. It's very encouraging, but I think some of us are worried with invisible illnesses or disabilities. It's going to be very difficult to prove need if it does go through the disability tax credit, because anyone who's known anyone who's tried to fill out that paperwork, it can become very discouraging for people, and they may not apply. And also, which we see over and over, if you have no one to fill out those forms, what do you do? Or no one has your mental health history, because these are major issues, and that's where a basic income for adults up to 65, even if it started for those who are most vulnerable, the people with no income, adults with no income, people who are living on assistance that is well below the market basket measure. And I do have to quickly mention, we are we're a United Way Halifax partner, and they're coming out with their new poverty solutions report next week. And they call the market basket measure like a consistent measure of poverty. And on many of the groups we belong to, that's really what we're trying to encourage. Because some of these programs, they're just very dehumanizing. And I do think that there has to be more time given to figure out if someone has never worked, and some of our panelists have talked about that. There are people who have not been able to work or can't work currently who do not qualify for CP disability. We can't be leaving people with no income. And the only other thing, I just want to quickly mention that our Canadian Mental Health Association, people may know, because that we have this advocacy program right now called Act for Mental Health, the campaign. And it's really trying to get a mental health and substance use transfer permanently placed federally, and also to create a universal mental health and substance use health act. Our province is advocating for universal mental health care, but it's probably not going to be happening without this transfer. And I know that the Canadian Alliance on Mental Illness and Mental Health, they're actually looking that we should amend the Canada Health Act to include mental health. And just one other thing I wanted to mention was, one thing with this mental health act for mental health, it's not only about clinical or more funds for funding for community agencies. It's working to create the social and economic conditions that contribute to good mental health. And we often put on our posts, because we're part of the CMHA Federation, so we agree with, we support our vision of universal mental health care. And housing is healthcare, income is healthcare, and mental health care. And there have to be comprehensive policies to recognize that. Thanks.
Thank you, Marg. And thank you to all the panelists for answering my questions. But we also have a number of questions being generated by members of the audience. And I'm really pleased to be able to bring some of those forward. And the first question is directed to M. M, people on disability subsidies have fixed incomes which hinder their ability to meet increased prices. What can be done to address the issue?
Yeah, I can't fix that issue in this answer, but I think that's a great question. And I think there's a lot of different barriers that folks who are on disability face with this. I know, like for myself, I have a family member living in Ontario who faces like a 10-year wait list to get into low income housing. And I think one area in terms of policy change is when, obviously displacement's not the goal here, but when people have options that are in different places across the country, they're also putting themselves at a disadvantage by leaving, because they lose the service that was tied to that province and have to go through that reapplication process again. And so I think that that's a big policy change. I have this as a personal circumstance for me with a family member who would otherwise be living with us at this time, just for that very reason. And so I think that is certainly a challenge. And I think really it's hard to put the onus on the individuals. It's the systems that are in place. There's lots of things that employers could do in terms of, raising their pay to meet a living wage. But for those on disability, I think, trying to get access to every possible program that is available. It's really a game of navigation and just kind of lobbying for change and having those conversations with people who are in the positions to make those decisions, I think is kind of the best I have for the moment. Thank you.
Great. Yeah, thank you for that, Em. I'd invite any other panelists to weigh in on that if you wish. Seeing now, oh, Mark, or sorry, Catherine, go ahead.
Sorry, we're just talking about benefit levels in for folks on disability programs across the country, obviously. And, the Maytree Foundation does a great job every year publishing information about what the levels of the different income security programs are, and competition, and obviously the other myriad of barriers that people experience accessing those programs. And, not just those programs, but the services that are tied to those programs, whether that's a drug plan or access to health services or funds for children's clothing in the winter and those sorts of things, so it's really important. And, it is beyond unconscionable, the levels of the benefit levels that are set are so grievously below Canada's established official poverty line and other low income measures. We've seen some movement, certainly for folks, they make that a large distinction too between folks on disabilities and those who are deemed able to pursue work, and who have very, very low benefit rates. But you see some provinces trying to boost benefits. Quebec just brought in sort of what they call their guaranteed income for people with severe disabilities. But you have to actually have a demonstrated disability for over 5.5 years to qualify for in this program, which offers much higher benefit. It is really, and it's a political solution, obviously. Governments, provincial governments have historically ignored this community. In most instances, benefit levels are not set to inflation, do not automatically rise with inflation. So that's a huge gap as well. But it is mobilizing and raising concerns about how desperately low these benefit levels are. And, clearly in today's context, it's levels of destitution, like there's no other way to describe it.
Great. Thank you for weighing in on that, Catherine. Another question from our audience, and I think maybe Marg and Catherine, I'll put you on the spot again. The individual raising the question recognizes that they've donated previously, but now can barely afford their own expenses, and recognizing that there is funding needed for food banks, shelters, housing, supports, etc. But who pays for it? Does it come from our taxes? We're all struggling to make ends meet. I couldn't afford another tax. What's the solution? Any thoughts, Marg? I'll turn it to you first.
You do hear, and certainly this is something that many people are experiencing, not just having to cut back on donations, but something we've seen, and I know a few people have mentioned already, that, that people who perhaps in the past used to volunteer in community agencies because they have to, maybe they're in school and they have 2 jobs, or they have 3 jobs, just trying to make ends meet, that has impacted in that area. And without a doubt, I mean, it's one reason I mentioned the economic costs earlier of mental illness in our country. I think we need to perhaps do a better job of explaining there's so much information out there and knowledge, but we don't do a great job of explaining that, and even, agencies and policymakers, in that if some of these solutions that are being proposed, could be adopted, there is evidence that it would in turn reduce some costs. Like it would, perhaps it would be neutral as when it comes to taxes. And I'm sure I'm treading into territory I shouldn't be in, but yes, that would take a longer time. But I mean, I think, looking at the Mental Health Commission of Canada, I think you discussed that way back when you wrote the first and only National Mental Health Strategy for Canada, and was it 2012? Those things were discussed. And also from that comment too, it just shows how caring people are. I mean, there are a lot of caring and compassionate people in this country. Mm-hmm. And we have to find the way that people see it's fair, and it can be explained, that this may happen, but it'll reduce costs in other ways. And the other thing that I was thinking about when we talk about basic income, there's also that issue of, people wanting to work. Someone that asked me a few days ago, well, there's all these for help wanted signs, but so many of those jobs are, minimum wage, and they don't have any benefits. And it's very difficult for individuals, especially if they have high costs of medications and they're on disability or income assistance. If there was some way besides a year, which is usually what they'll give you, if you're not probably going to have benefits, or if there were some ways to, make that change so that people who can work but can't receive benefits could receive benefits, could be paying taxes, where people are concerned about that. But I personally believe, and Catherine would know more than I, because she is a long experienced policy analyst, that there's evidence that costs in the long run would be reduced.
I'll be quick on this. We are not going to donate our way out of this particular pickle that we're in. I'm not trying to be dismissive. It's really important that and the question about revenue generation is really important. We want to have robust and fulsome social safety net in Canada that recognizes importance and creates conditions for individuals, families, and communities to thrive. And that demands progressive taxation. And it demands, individuals, wealthy folks will always be able to secure the support and they need, and that's as well demonstrated in this particular area, where it's really the two-tier does exist, but it's really important. We had a report out of StatsCan on Friday talking about, who won the pandemic? The top 1% won the pandemic. Their incomes were increased with capital gains by 20% in a single year. So, and whereas for the bottom 50%, actually, they were down a quart. They actually lost $1,400 as pandemic benefits wound down between 2020 and 2021. I'm not being facetious. I do think there are many ways that we can introduce more levels of taxation. We have to pay for what it is, but in making these investments in public institutions, as Mark is suggesting, creates conditions where everyone starts, including business. It's a false economy to think that, by, scraping everything to the bone, somehow, the pressures, all that does is privatize pain and suffering on individual households and individuals themselves. So I work in an organization where we put together policy proposals around progressive taxation and other types of income sources that we believe could be profitably pursued to strengthen our public institutions, including services that would support folks with mental health challenges.
All right, thank you both. Asifa, maybe I'll ask you and Em to both weigh in on the next question, which is really around recognizing that publicly funded programs are already at their limit, and there are already, access barriers and wait lists for many of the services. As provinces and municipalities receive or have funding for services like housing, how can they effectively use those resources, given that the services are already oversubscribed with wait lists?
I liked Em's answer earlier where she said we can't really answer that question in the 1 minute here, but before I even attempt to respond to that one, I just wanted to add to the previous question that I think when we have restrictions on people who are receiving supports like ODSP and such around what they can earn and cannot earn, then we're actually really affecting people's dignity, and especially when there is a desire to work and we're taking away a lot that actually adds to their mental unwellness. We have people who are really willing to work, and we have a requirement for labor for people who can do work, and yet we ourselves are putting in those restrictions. So I think we really need to look at that as well. In terms of the second question, and what can we do? Gosh, I mean, at a small level, I feel like we need to kind of change the thinking in terms of how we do funding. We have to shift the models of funding. I feel like we will never have new monies in our basket. It'll always be the same amount of money. So we have to find ways that we can share that money more equitably across the different silos that we have, the different sectors that we have. And I think giving flexibility to organizations to allow them to be more creative will allow us to be more flexible and maybe do more with what little we have, right? Because there are already lots of expectations and criteria from funders on what you should do and what you cannot do, and you can't use this basket of money here, and it has to be reported in this way, and you have to meet these many contexts and criteria, and like all of these things. I think if we can just relax some of our expectations around those pieces, we may be able to come up with some creative solutions together.
Thanks, Asifa. Did you want to weigh in on that at all, Em?
Yeah, sure. I don't have anything long, but I think maybe two big points. We do tell people to kind of prioritize themselves and take care of themselves, and then we don't give them that option to do so. And I think when it comes to these programs, it kind of goes against, we have this massive push for productivity in society. And then so we have these programs that are coming in and they want to help. And to me, the biggest thing it comes down to is whether or not the funders and those who are acquiring grants and money to do this, are there people with lived and living experience embedded in those groups from the start, helping to make decisions about, because what we might need, I'm in Corner Brook, Newfoundland, Labrador, what we might need here is different than what they're going to need in Toronto, Ontario, is different than what they're going to need up north. And I think that's the most meaningful difference that could be made, is to make sure that when those funds are getting spent, the decision to direct them, do you give everybody a little bit? Do you make housing for a certain number of people? I think that really is going to be too complex to unpack just as a one size fits all. And I would really strongly encourage anybody who's in that position. I mean, I've reviewed a lot of different funding packages from some big organizations who have included people with lived and living experience, to make sure that they have that voice. And so I think that would be kind of a big first step to make sure that the people that the money is actually going to in that community have a say in how it's being spent, which also points to what Asifa said about having flexibility in project funds and not having to dedicate a specific, this $500 can only be used for pens and paper, as opposed to adapting to the needs of the communities that need it most. Yeah.
Very good. Thank you for that. We've talked a lot about housing and Housing First as a model, and it seems that that's a high interest topic for individuals asking questions. So I'm kind of rolling a few questions together. But one audience member asks Asifa, Housing First has lost steam over time. Has the ball been dropped, or why has the ball been dropped on promoting or scaling up Housing First as a supportive housing initiative? Do you think that's true, first of all, that the ball has been dropped on Housing First?
I do feel that way. I feel like when we had the project itself, the 4-year, the rollout, there was a lot of media, a lot of attention given to it. And we had a lot of research following it that was really positive, good research, and a lot of good resources and tools came out of it. But now you don't hear about it. And I think in principle, there is a desire to support Housing First models. And while some funding has been rolled out, unfortunately, it does not come with rent supplements. And that is the biggest, factor in its failure, because the rent supplements is the key point in terms of providing those the Housing First model. So yeah, I feel like we have lost sight of it, and that's why I kind of mentioned the Finland piece and the New Zealand piece, because it is relevant and thriving in other areas of the world. We just need to bring it back in, because we as a country invested a lot of money in making it an evidence-based model. So let's take advantage of it.
Very good. Thank you, Asifa. Marg and M, what suggestions or strategies would you suggest to build capacity across the mental health system to provide people with low incomes and mental health concerns rapid access to counseling services? So, recognizing that in many places there are long wait lists for those publicly funded programs.
Well, I mean, I've already mentioned that certainly in this province, in Nova Scotia, there is work underway to, but of course the devil's in the details, but to have universal mental health care. I mean, it has to happen. It really does, because we've had enough studies to know the right help at the right time, and no door being the wrong door. I mean, that can be transformative for people. Of course, we also have to address the social determinants of health, but I think that looking at that and also not putting up so many barriers, I think sometimes although I know sometimes for people who are working in government or in health authorities, they can't always speak about scarcity, but sometimes it seems like that, things currently are so triaged. And I think everyone's trying to do the best they can, but unless there's more time for, I think, initial assessments and supportive counseling and not a concept that maybe, you know, you have so many sessions and then everything's okay. You know, people need follow-up. They need to know that someone's there, that at least they could call on, because it is, when I said about tearing down silos between places like, at least in this province, community services and health, or health authorities, I mean, it is, I meet so many people who, you know, you can't go to a walk-in clinic, for example, and get a disability tax credit form filled out. I mean, they're not going to do that. They don't even know you. And yet there's that expectation that people are going to have those forms, you know, filled out by professionals. So I just think that instead of stopgap measures, I think we have to support, like in this province, they're trying to have universal mental health care, but like I spoke about before, really, it didn't happen last year, but putting the push on for the federal budget to have, you know, a real mental health transfer. I think for years, what's happened is that the money comes to the province and it's not in, you know, there's tremendous need in health. And I'm not saying we should take money away from health. You know, we need a bigger pie, but that's been discussed about having a mental health transfer. And that really I think people feel there's nothing they can do, but we need the political will to make this happen.
Great, thanks, Mark. You're located in Newfoundland, where you know, the implementation of Step Care 2.0 as a model of care has been seen to really improve wait times, reduce wait lists by about 70%. Your thoughts on what can be done to allow quick access to counseling services and reduce wait lists?
Yeah, and I mean, I actually wasn't even living in Newfoundland when that got rolled out. I am back here now. I think that that's, you know, obviously improved wait times. I think that there's work to be done in terms of getting the people the care that they're looking for. And I think we have a long way to go in terms of also including maybe non-Western forms of care into our mental health care coverage. As an Indigenous person, you know, there's ways of healing. There's other supports that can be leveraged, that should be leveraged and included within our healthcare system as well. And I think that that is something that we're sort of heading towards. And it's gotten more traction in some places than others. I think that that's a big one. And also just, you know, I don't want to speak directly like to step care, which I think has been helpful, but we just don't have the access at this point in time. People don't, we're so spread out, so rural. Outside of St. John's, it's the services, we just need to have better access, and those that are living rurally are not necessarily in places where they can physically access the services they need. And maybe they're, you know, an isolated senior who's not going to be having a video call with somebody. And I think that that's some problems we have yet to address, and those walk-in clinics are pretty busy. So yeah, I think we have some ways to go, but I would like to see some changes in terms of the breadth of services, and you know, having people be a lead in their own care as well.
Great, thanks so much, Em.
Can I add
yeah.
just a
Go
quick
right ahead,
piece,
Jessica.
Ed? Especially to the point where Em made about different types of healing modalities. And I think, you know, I think we really need to recognize value and support different ways of healing that occurs around the world. And so at Across Boundaries, we do offer, you know, traditional Chinese medicine, acupuncture, and various other things. And as it was stated, it's not offered free of charge outside of an organization. And I think we need to make those more available without getting hung up on what is evidence-based. We need to look that for thousands of years, some of these ways of healing have worked in different countries, and we need to be able to incorporate them because that's the way people need to heal. And we need to be able to offer that and make it available.
Great, thanks, Hasifa. One of the questions from the audience is actually directed at me, which is usually as the moderator, I don't get to answer any questions, and I won't take a lot of time, but the question is, Ed, as the only male on the panel, I'd like to hear your thoughts on men's mental health and the crisis we face as individuals, fathers, brothers, and community members. That's such an important topic that I just couldn't go by the question without pointing to our website, the MHCC website, because I was very privileged to be part of a webinar that was just released about a week and a half ago on this very subject of men's mental health. and in particular, men's mental health as it relates to suicide, because as most of us know, of the dozen or so people that die each day by suicide, about 3/4 of them are men, which is a bit of a paradox because men actually make fewer attempts at suicide, but use means which are more deadly and therefore have a higher rate of suicide. At the same time, men are not accessing services or not able to access services or receive services at the same rate as Canadians on average. And a number of reasons for that. Men come, especially middle-aged men, come with this kind of attitude of stoicism, and I should look after myself, and I shouldn't be, talking about touchy-feely things and seeking help. I should look after myself. But at the same time, many men experience illnesses like depression in a way that doesn't look typical. And so, they may be actually going to healthcare providers, their primary care physician, and having their depression not recognized because it's showing itself in increased aggression or in increased substance use or other ways that are not typical ways of looking at diagnosing depression. So a lot of factors going in to men dying more frequently at a higher rate related to suicide. So I'd really encourage you to take a look at that webinar. It lays out some potential solutions about how getting men together to be what we call shoulder to shoulder, working on a task through which they can kind of stimulate peer support conversations can be really effective, and some examples of good effective programming across the country and beyond. So thank you for that question, and thank you for the opportunity to promote that previous webinar that's been posted on the Commission's website. Asifa, based on your experience with asylum seekers, what specific changes could address issues under federal refugee health policies to mitigate uncertainty, isolation, housing, unemployment, and lack of mental health supports?
Oh my God, my eyes just glazed over. It's a big question.
It's a huge question.
It's a huge question. I mean, as soon as you mentioned asylum seekers, my mind just went to what's happening in Toronto currently, with the number of folks who are just being housed by churches and other community spaces because there's no space available in shelters and whatnot. Honestly, I don't know what to say.
All right.
Yeah, I mean, it is really tough, and it's so interconnected with so many things. I don't know that there is a simple answer, but there are other wise people on this panel. I don't know if anybody else has anything to add, but thank you.
Yeah, thank you, Asifa. A really tough question, and I understand we're pretty much at the end of our time. So I would like to give each of the panel members just 1 minute for some final thoughts on what action do you think should be taken now at the individual, community, or policy level to help address the impacts of the high cost of living on mental health? In 1 minute, what do you think your priorities would be in terms of actions to take now? And I'll go to Catherine first.
Thanks, Ed. 1 minute, one topic. I will circle back and say I would hope that the mental health community, orgs and so forth, become active in the design of the new Canada Disability Benefit. We're talking about one intervention that'll have a large impact on literally hundreds and hundreds of thousands of people with disabilities. That would be it. And to ensure that folks with mental health are included in the design of that benefit, and that the level is set such that it makes an appreciable difference in people's lives, and that it is not clawed back, certainly from those folks who would currently rely on social assistance, right? That's the big worry, that it's just money that'll go in, that'll go to fill provincial coffers as opposed to actually landing with the folks who desperately need that assistance. So I would say that would be one measure that's immediately in the next 12 months that has the potential to make a huge difference.
Thanks, Catherine. Em, over to you.
Yeah, I think for me, and I know this has been echoed pretty largely in the chat throughout the last hour or so, but I think one of the biggest things is just having a living wage as opposed to the minimum wage that people are able to afford to get by, or at least have a much better chance at it. And I think that's something that needs to come with a lot of public noise about that, and sharing your stories. I know that there's evidence to support it, and also anecdotally stories are moving to people. And so if you're in a position to have any influence over that, I would definitely encourage folks to talk to the leads of your organizations, talk to government in terms of how that's possible, in smaller scale ways and kind of countrywide.
Thanks, Em. Mark, over to you in a minute or less. What action can be taken now?
Yes, well, I certainly agree with Catherine, what she's with everyone that's been said, but I do think that for people, particularly who are vulnerable and have no income and are well below the market basket measure, we need to have some form of basic income. We have to start working towards that.
Thank you so much, Mark. And Asifa, over to you.
Thanks, Ed. I think I would simply say that we need to recognize the double, triple, quadruple whammy on the most marginalized in our societies and try to level the playing field in some way. I think we always need to be in advocacy mode, particularly as organizations, recognizing that there are a lot of inherent systemic issues that create inequities and disparities. And I think we should also be able to learn from other jurisdictions where innovative solutions are happening. And develop the necessary policies, the necessary funding envelopes, and the necessary will to address this. And one very small piece is I think I'm always hearing a reference to evidence base when we want to try to do something. Let's invest in creating that evidence and not only rely on what already exists. Thanks.
Very good. Thank you. And thank you very sincerely to all of the panelists and to all of the audience members for participating today. This brings us to the end of our webinar. We've not had a chance to get to all of the questions that you generated, so thank you for those. But our team will be following up and try to provide some responses individually from the panelists. The team will also be sharing a survey, which is an important part of our own quality improvement here at the Mental Health Commission. So we'd really appreciate if you would please share some feedback on your experience here today, which will help us make webinars even better in the future. It's been a real pleasure to be able to moderate this discussion today on an incredibly important topic, and I hope you found the discussion valuable. Again, a very sincere thank you to panel members. Huge thank you to the team here at the Mental Health Commission, in particular, Katerina and Zach, for all of their work going into this, and to the whole team here at the Commission. Thank you all and have a great day.